Hi, Adele, I'm Kate.
Hi, nice to meet you.
Nice to meet you too. Can you tell me a little bit about the pain you've been feeling or previous injuries before our session?
Okay, so I have like lower back pain. It's more towards I want to say my coccyx area, like,
Yes.
around that area. It started around 10 years ago. So it really does stop the movements in my body, like bending, picking up stuff, even waking up in the morning sometimes very difficult. It literally, I don't know what it is, to be very honest with you. There was no
Yes.
specific history or injury that happened, no accidents, but just one day it started
Suddenly
and it's
happened.
just gotten worse.
So it could have been over time with a small baby. So what we're going to do today is I'm going to teach you all about the core and how to activate it properly, because often that's an issue, or that's a start of where things happen. And do you know if you've got tight hamstrings?
I think I do, to be honest.
So often that's one of the first things we look at as well, because your hamstrings attach to your pelvis. So if they're extremely tight, they can actually change the tilting of where it is, and often that can put stress on the lower back. So that's an important thing to do as well. So we'll do a couple of things to test. But first, I want to basically explain to you what your corset muscle is. So there's a muscle, if you put your index fingers onto your two hip bones in the front, yes, and then you go slightly inside from those bones, as though you're going towards your belly button, and give a little cough. Did you feel that muscle coming back at you?
Yes.
Do you promise you felt it?
I promise I felt it.
I have people in my class and they're saying yes, and I'm sure it's no.
I promise I felt it.
Okay, perfect. So that muscle is called transversus abdominis. Anatomy names are extremely long, but it's often called TA or TVA for short. But the way I like to think of it is it's your corset muscle. So if you imagine you've got the bones of your spine on top of each other, and that innermost muscle around that spine is your TA. So we want that muscle to stabilize milliseconds before you move. So it's basically your stabilizing muscle. In the body, we've got stabilizers and movers, and some act as both. But the transversus abdominis acts as a stabilizing muscle. So to activate that, you felt it push into your finger when you coughed, but to activate it, you pull it in the opposite direction. So you need to gently draw it away from your finger. And the hardest part about this muscle is the fact that it only needs to be activated at 30%. Because as humans, we're pretty much all or nothing. So that it's quite difficult to get that. It's just like a light bulb that's turned on. And it's got to be active the entire time you're awake. So not only when you're in the studio, but when you're going about your daily life, the only time it should not be active is when you're sleeping.
You always have to like caution.
Exactly.
That's this.
So the way, so it's almost like you're trying to gently pull your skin away from your gym pants. Or another way to do it quite nicely is if you think about drawing your hip bones gently towards each other. That action of like, I want to bring my hip bones closer together.
Sorry, I'm envisioning
it. No, it's perfect. We give a lot of imagery in Pilates because some things will resonate with people, and suddenly it's like a light bulb moment, it clicks. So I also say, imagine if you had a rope bolted between your two hip bones, and you wound it up on either side. It's like a spreading and a flattening feeling. So often you think of in the gym, or you think of like your muscles bulging to work, but with the ab, you actually have to pull it in the opposite direction. So you never want your abs to pop out to strain to sort of hold you. You actually want them to keep drawing down. Okay. So we're going to try a few exercises engaging TA and learning how to keep TA while moving, because obviously that you then got to everything has to be able to move off it when it's still engaged. So I want you to lie down on the mat for me. And then you're going to bend your knees for me, and you're going to put your feet flat on the mat. So now what I want you to do is find that muscle for me. So put your index fingers onto those two hip bones, slightly inside there. Then we've also got the pelvis. If you think of it as a triangle forming with your pubic bone and your two hip bones, if you had a triangle on your pelvis, in a neutral pelvis would mean it's flat. So it would mean that you've got a bit of a gap in your lower back, or between the back of your pelvis and the mat in neutral. And we want to do most of our exercises in Pilates in neutral, because like you've got the transversus abdominis at the front, you've also got muscles at the back called multifidus. It's like a feather-like muscle, and it acts as the corset at the back. So we want those muscles. We want the back muscles to move. There's often this thing of don't use my back, but if you don't use the muscles and they're not strong, then they're going to be too weak, and that's where the problem sort of comes in. So we try and do most of our movements in neutral. if you've got really bad back pain, then we can start in what we call a posterior tilt, where you would squash your lower back into the mat.
Yeah, okay.
But then we try and, as you get stronger, we try and work back towards neutral. So now in neutral, have you got back pain while you?
No, it's slight, very slight. Yes.
Okay, so we're going to do a few tilts, which you can do at home if you're really battling with your back.
Okay.
So put your head in. I know you're looking at me.
No, sorry.
Thank you, very polite. No, but I just don't want you to get any neck pain. Okay, so what I want you to do is I want you to tilt your pelvis to squash your lower back into the mat. Yes, so it's almost like you're squashing a blueberry flat.
Yes.
Good. Then I want you to go back to the neutral position. And then I want you to try and arch your back even more, which might feel quite painful. So don't, yes. Okay. So give me more of gap, like I'm trying to slide a pool noodle between your lower back and the mat. Good. So it probably feels like quite a bit of a tug on the pelvis. Yes, on the lower back. And then go back to neutral for me. And then squash your lower back into the mat again for me. Good. Go back to neutral. And then go into more of an arch, which we call an anterior tilt. Yes. And then go back to neutral. Let's just do one more each side. So tuck that, squash the lower back into the mat. Good. Go back to neutral. And then back to more of an arch. Good. Does it feel like it's almost warming up as it gets along?
Yes,
like
it's not tuggish. It's not so sore.
Not as sore as big. So this is a great exercise you can do at home. If you don't have a mat at home, you can just do it on the floor. Yeah. To warm up, because sometimes especially in the mornings when you first wake up and it's really sore. So don't do it on your bed because it's probably too soft, but do it on the floor. Just go between those movements and it'll make a difference. Because once the muscles warm up, that's why you feel better during the day after you've moved quite a lot. Yes. Yeah, so that's a good one to do. Okay, so now keeping neutral, we're going to try and activate that TA and make sure it's firing properly. So I want you to keep your index fingers onto those. Yep, so find the muscle. Yes. Good. Can you feel it activated? Is it pulling away from your finger?
I feel like it is. Yes,
okay, I do. Good. Then I want you to slide your right heel away from you along the mat, keeping that TA active. So just slide your leg away and slide it back. And with this one, if at any stage, as you're learning to activate it the whole way through, if there becomes a certain movement, like you've almost straightened your leg and you feel like it's gone, you can just stop, re-engage it, and then carry on and get it going. Okay. So it's a good way to start to sort of doing at home. You can do 10 on one side, 10 on the other side. So let's just do this heel slide again on the right.
This one, same one, eh?
Yeah, let's do the same one. Can you feel it still active?
Yes.
Good. And then draw it back. So keep it sliding the whole way along the mat.
Okay.
So are you getting stuck on the...
No. I thought it would,
slide it without lifting it, because that's, So let's do one more here. Yes.
You feel more, yes, okay. I can feel the difference.
Yes, feel it more.
I can feel the difference.
Yes. Okay, let's do it on the left side. And sometimes one side will feel easier than the other.
Okay, I can definitely feel a difference.
Did you feel that?
Yes.
Okay, so do 2 more on that side as well. Good, and last one. Good. Then the next exercise we're going to do is engaging TA, but now you're going to just move this knee further out to the right. So it's like you're dropping that knee out to the side. And if there feels a point where you suddenly lose it, that's where you stop and come back. Yeah. Okay. There's often an end point here where you're like, oh, I've lost it.
Yeah, about here.
Yes.
And
then draw back in.
Okay.
Good. And then let's do one more again on this side. And draw back in. Good. And now try on the left. So let the left knee drop out to the side.
I feel like that has less range of motion. This one.
Could be. Yeah, that's quite normal. Is any of this causing any back pain?
No.
Okay, good.
And usually it would be.
Usually it would.
Yes.
Okay. And pull back in. So once you've mastered those, I'm going to show you the next one because then you can practice it at home. So the next one to do would be engaging TA, and you're going to float this right leg to tabletop. So tabletop is your knee is directly above your hip, shin is parallel to the mat, and your toes are pointed. And then you keep this angle the same. Sorry, my hands are cold.
No, it's okay.
But if you keep this angle the same, you tap your toes down to the mat and bring back up. And tap down and bring back up. Keeping TA engaged.
Yes, okay, so you've got to focus
So
it again.
it's so much of it is very mind. It's very important. Yeah, you've got to really concentrate on which muscle, and that's why we touch it, is because it's telling the brain that's the muscle I want you to activate, and eventually that neural pathway strengthens and it becomes habit.
Yes.
Yeah. So this is a good. Let's do 2 more on this side.
So
tap it down and float up.
Sorry,
and tap down. Perfect. And then place this foot down for me. And then you're going to lift the other one up as well. Good. Yes. And then tap that down. Good. And float up. Nice. Tap down. Can you feel it on that side?
Yes, I can.
And tap down. And float up. One more. Tap down. And float up. Good. And then place that foot down. And then the real test is to have both legs up at the same time.
Okay, let's see this.
So let's engage TA.
Okay.
And then you're going to just raise the right leg for me, keeping it. And also you want to keep that pelvis in neutral. So try not to let your lower back squash into the mat, but let me know if it's sore.
Okay.
Keeping that engaged, you're going to bring the left leg up to join.
See, that tugs on the back a little bit.
Okay.
Yes, it does tug on the back a little bit.
Yeah. And then place one foot down at a time. So once you can get TA active and nice and strong, when you're lifting both legs up, then you're able to do a lot more movements in your spine. But I really think that those tilts are going to make a huge difference. And then let's just do a few pelvic curls, because that's also like a massage for the spine. So arms along your sides for me. Good. I want you to think of really resting your head, like letting it hang heavy in the mat, so the neck is relaxed. And then I want you to keep the head pushing into the mat for me, and I want you to draw your chin down towards your chest. Lengthen. Do you feel that stretch in your neck?
Yes, I do.
Good. And then relax it back to neutral, which neutral would be, if you were standing up, your chin would be parallel to the floor. Yeah. And then draw it down again. Good. And back to neutral. And then draw it down one last time. Good. And hold it there for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax it back to neutral. Good. So now I want you to keep your head, try and keep your chin in that position in neutral. Keep your collarbones nice and wide. Good. And push the backs of your arms into the mat. So the muscles in the arms are all active. Okay. Your feet, your heels are in line with your bum bones. Good. So basically we say a fist between your feet, and then your knees stay in line with your feet. So I want you to start with a neutral pelvis, which you're in, which is great. Then you're going to inhale, draw in your abdominals. And as you exhale, you're going to tilt your pelvis and squash your lower back into the mat like we did earlier. Yes, so squash it. So now your pubic bone is higher than your 2 hip bones. Okay. Keeping that tilt in the pelvis, I want you to engage your bum muscles, push through your feet and push through your arms and your hands, and you're going to slowly lift your bum up off the mat. So keeping that tilt. Yes, lift your bum up, lift your lower back, lift your middle back, lift your upper back. So you've got a nice diagonal line from your shoulders to your knees. Is your back okay?
Yeah. Slight tug, but it's not too bad.
Okay. Then on an exhale, you're going to slowly peel your spine down one bone at a time. So it's like you're doing the opposite.
Okay.
So you place that upper back down first, one bone at a time, then the middle back, then the lower back, then the bum touches down, and then you untuck back to neutral. Perfect.
Okay.
Good. So it's like a string of pearls, lifting up one at a time and putting it back down. Let's go again. Inhale, draw in those abdominals. Exhale, tilt the pelvis, squash the lower back into the mat. Good. And then lift the bum up. Lift the lower back, middle back, upper back. Try and make sure there's even contraction in both glutes, equal pressure in both feet and both arms, so you're as even as possible. Good. On the next exhale, slowly peel that spine down. Get the upper back to touch first, then the middle back, then the lower back, then the bum touches down and the pelvis goes back to neutral. Did that second one feel a little bit easier than the first? Good. Let's do one more. Inhale, draw in those abdominals. Exhale, tilt your pelvis, squash the lower back into the mat. Lift the bum up. Lift the lower back, lift the middle back, lift the upper back. Good. Reaching those knees forwards. Nice diagonal line from the shoulders to the knees. And on the next exhale, slowly peel that spine down one bone at a time, getting the upper back to touch first, then the middle back, then the lower back. Bum touches down, pelvis goes back into neutral. Good. Well done. So if you can do those all of those things at home.
Yes, I think
a few of those things, because sometimes if we have too much of a list, then we don't stick to it.
Yes.
But I think it'll definitely help ease that pressure. Often we think, oh, I can't move, but actually if we don't move, it's the worst thing to do. We've got to move within your range, and we're trying to get movement with less pain.
Yes. Yeah. Because sometimes you think, oh gosh, it's too sore, let me not do anything.
Exactly, which is actually the opposite of what you need to do. Yeah. But it's understandable, because sometimes the pain is so sore that it does stop you from doing things.
Yes. Honestly, I must say there is some relief, because generally, like even getting up the way I did now would be sore. So those stretches, I genuinely feel like they aided that just a little bit. And I feel like over time doing those continuously is going to help.
Brilliant.